We're good.
Hi everybody, we're back. I'm back. So we've done a sclera before, which we're doing today. Today we're treating, so Lindsay, if you could just show us, I know that we've explained this before and it was hard to see, but I'm hoping that we can see it a little better today. Show us where you're treating on
We're going to start on her right side here.
Okay.
We're going to do this reticular vein, which is basically causing most of the spider veins that we're seeing. So I'm going to try to treat this guy, and then we'll come down here and do some of the spider veins. And if I have enough product left, I will then try to do a few of these reticular veins. The reticular ones are the deeper, larger green ones. And then the spider veins that most people notice on themselves when they come in, that's usually the reason people come in, are these guys.
And generally you've said the rule of thumb, people will sometimes ask what area, like the size of the area they can treat. So the rule of thumb is the size of your hand.
About
the
your palm
hand.
size.
I don't know how big your hands are.
Right.
Yeah.
So we're hoping that, so I can only use in one treatment this, for safety reasons, we're only using 1 ampule of a sclera. This is 10 milligrams, per 2 mLs. So this is divided up into 3 1 ml syringes, 33 gauge needles. And honestly, it just depends on the person and how they respond. I can sometimes treat every spider vein that's an issue in one treatment, and other times it's just a smaller area.
So usually people want to treat, like these treatments are, we have like, it's like laser treatments. You want to do this stuff in the winter. So you have to wear the compression stockings. You want to do it now so that when you're at the beach, you're like, I can
to stay out of the sun.
Yeah.
Yes, exactly.
Yeah. Because you can cover, like people will cover with stockings or whatever in the winter, but in the summer you're wearing your bikini and whatnot, so you don't want, obviously.
Exactly. These are compression stockings, which this patient will be wearing because it's behind and above the knee. She needs something that kind of goes all the way up into the waist area.
If you were to do something that was below the knee, we'd give you these. So these are shorter. You wear them for what, 2 weeks?
2 weeks.
2 weeks.
It's great. It's actually, it's essential for getting the results that we want. You really should wear it day and night. Also refrain from any aggressive exercise. Running is not good for a couple weeks after this treatment. You could swim after a few days, but just take it light, for 2 weeks.
And if you were curious about if your veins fall within the parameters of what we can treat, just book a consultation. We'll come in, Lindsay will look, and then we can, or we can refer you if they cannot be treated. But so the fun part. Let's do it, girl.
Okay. So I'm just gonna clean the area. Some alcohol.
There shouldn't be any pain associated. There's always a little bit of a feeling. You're going to feel, of course, the prick of the syringe, and you feel the product going in, I presume.
Okay.
We've made sure our patient is
Just
relaxed and happy. She's just resting. Here we go.
See in the hub? That is showing me that I'm in the vessel.
Ooh, that looks good. It's always the best part, watching it like disappear like that.
Yeah.
It's hard to see on camera, so people at home can't really see that the way we can.
You can't see it on the video.
But but we watch it disappear like before our eyes. But what is?
Look, it's you should be able to see that on the camera.
Yeah, I think you can. I think you can. Yeah.
So that was a good treatment. You can tell it's gone through the vessel. It doesn't mean that it's going to be 100% cleared after this one treatment.
Yeah.
It could be, but it also may come back just a little bit lighter, and then we'll do another treatment just the same in 6 weeks.
Yeah, so in 6 weeks, you'd want to do the follow-up regardless.
Yeah.
And even if they feel like they've resolved, they should come in, have you take a look, right?
Yeah. Oh, absolutely.
Yeah.
We do a follow-up no matter what,
Yeah.
6 weeks out.
And then if it happens to be that you need more treatments, then you can do more treatments, at that time.
So the hope is that by treating this larger vessel, some of these will resolve indirectly, because basically this one feeds these ones. Okay.
Yeah, so like by proxy,
Yeah.
they're all attached and they're going to accept that product. How much time does it take for that to travel through?
Oh, it's instant.
Okay.
Yep. So the rule of thumb is if the area desired to be treated is not fully treated in 3 treatments, then we do a referral out. We have a few vascular surgeons on our referral list that will take a look and make sure that there isn't more of an issue going on. Usually an ultrasound would then be indicated, and then who knows, maybe they need an ablation, which means that the larger vessel I can't treat gets ablated, and then they would come back to me and get some more of the smaller ones. I'm going to go ahead and try to treat another area here. Let's see about this guy.
Here we go.
I'm there.
We have a brave patient, so she's doing well.
Oh, this was a good one, patient.
Oh, ooh, that was a doozy.
See?
Mm.
That's a good one.
I love
so
the instant gratification.
It's
of watching
instant.
it
Yeah,
disappear.
it is great because,
Yeah, that's awesome.
and you can tell
And-
that took care of really a lot.
And at home, people
This-
should know, like,
Yeah.
one of the things that people love about the vein treatments, even with like the Cutera, the veins on their face, but this vein treatment is that, like, if you look at this patient, like the shape of her body, you're looking at her and you're saying, wow, beautiful shape to her body, beautiful legs. And everyone has that. They'll say, I work out, I look amazing, but you can't obviously work out and get rid of veins. So, like,
Working out
this
is going
insane.
to make the veins worse.
The last time
So
we
that-
did this,
so
I
this
felt
is
the
a-
same
yeah,
way.
so-
But it's like to watch them disappear like that, and
Right.
how now she has that even like color to
Look,
her
it
skin.
compares
It's
to this
beautiful.
leg.
Yeah,
This
it's
one
amazing.
was like, worse, right? And so
Yeah.
now it looks better. And this is, an accurate assessment as far as how much did we get successfully treated. Everything that you see that seems to have resolved was successfully treated.
Yeah.
Maybe it'll come back, like I said, but this is a good treatment. She'll have really good
And
results.
we will. So Lindsey will finish the treatment now.
Yep.
Off camera, and she'll do the rest of the treatment. We'll send her home with the stockings. We'll schedule her follow-up. But if you guys want to schedule your follow-up, your consultation, just call us. We're here. You can go to either location. Lindsey's at both locations, so either Canton or Brookline, and we will see you next time. Bye.
Bye.